820, Big 550 KTRS. Dr. Bradley Freeman's going to join us, and then Kat Neville's going to be here in studio, talk a couple of restaurants for us. Dr. Bradley Freeman is professor of surgery at Washington University. Good morning, Dr. Bradley Freeman.
Hey, good morning, McGraw.
I think this is an important topic you want to bring up because me, anecdotally, I've lived in a couple of different places. I don't necessarily have a primary doctor. I go to a different doctor, and there are no real medical records. They're all strewn all across the country. But a way to put those all in one place so the next doctor I go to will have some history of me, that's kind of an important deal, and it can be done, can it?
Yeah, well, this is a concept actually that's been around for a long time, and that is giving patients access to this document that we all see when we go to the doctor. The doctor is, a few years ago, was writing busily in a paper chart, but now, by and large, is entering something either on a tablet or a computer in his or her office. And as in many things with technology, including the internet, there's potential to give patients tremendous access to this document, and also to facilitate sharing amongst physicians, whether you locate from one part of the country to another, or whether your medical condition would require consultation between, say, your primary care physician and a specialist. And one of the motivations of the Affordable Care Act was to foster electronic medical records, and kind of an offshoot of that is now to give patients access to their medical records. Now, legally, a patient has access to their medical records, but as you allude to, if someone is writing a chart, that would entail, after each encounter, you would have to get a copy of that record, and it might or might not fit together in any coherent fashion. But increasingly, there are a number of healthcare systems where patients can get access through the internet to the electronic record and see everything a physician documents. And there's a lot of potential benefits of this. So number one, it presumably would give the patient a lot more insight into their medical condition and the treatments that have been recommended, and as well as understanding how to be compliant with physicians' recommendations. And so there was a pilot study sponsored by the Robert Woods Johnson organization that looked at this concept in three very distinct sites across a number of primary care providers, and found that in fact that was the case, meaning that when they surveyed patients that availed themselves to this technology, they really had much greater insight into their medical condition. They understood the instructions that the physicians and nurses they interacted with gave them, and they were much more likely to be, say, compliant with the recommendations, whether that recommendation might be diet or exercise or losing weight or stopping tobacco smoking or taking your medications as directed. So there appeared to be a lot of benefits. Now, there's obviously potential for downside. Sometimes patients or physicians might write things or note things in the medical record that the patient might find off-putting. Say a physician is concerned about cancer or says something or writes something that the patient might take offense to, such as concerned about the patient being an alcoholic or substance abuse or that sort of thing. And there was a concern that it might change the manner in which physicians document, but the study would suggest that even that wasn't the case. So it did not appear to inhibit the physicians in any way, and I think is really a very powerful tool to facilitate communication between the physician and the patient. I think a number of healthcare centers are doing this, and I think I would encourage physicians or patients to look into this opportunity with your primary care provider.
So, I mean, is there any legitimate reason as to why this hasn't happened? Because, as you said, I mean, they've been talking about doing this for 10, 15, 20 years now.
Well, I think in many respects the medical community moves slowly, and that's not because we don't want to facilitate communication. But I think there are some. It certainly has to be a secure website, and you have to be very so there has to be some investment to ensure that. And I think there has to be rollout, and certainly part of that is educating the consumer, who is the patient in this case, as to how to access the records. And I think the third thing is it's not quite as simple as just giving them access to what, say, physicians could see working in their office in the hospital. So there has to be really kind of a standard operating platform. And because some of these organizations are so huge, to engineer all that is quite an undertaking. So I think it just reflects both the mindset and technology kind of catching up to the concept.
Gotcha. What's this story that they're short on IV fluids?
So this is very surprising, and we've talked several times over the last several months about problems in the supply chain that resulted of shortage of critical medications and things. And in recent months that have come to the fore have been, say, medications to treat heart disease, or medications to treat cancer, or say medications that are sedatives that physicians say need in the operating room. But this in the last week turned out to be something that is very basic, and that is the most basic or simplistic IV fluids, and these would be called, say, saline solutions. So technically these are things that you could manufacture in your kitchen if you were so inclined. And it turned out that hospitals across the country have gotten emails that were approaching a critical shortage, hopefully short-lived, in IV fluids, and they attributed that to two factors. Number one was there's been a spike in demand because of the flu we've seen this season, the H1N1 flu, so that's spiked hospital admissions and demand for all kinds of services and resources. And number two, one of the principal providers of these types of fluids in the United States, which is Baxter, had a scheduled shutdown and interruption of manufacture just to allow FDA approval and quality assurance. And the company said that was actually more short-lived than anticipated, so that would be something that had been scheduled and engineered into the system. But I think this story really shows us how fragile the system is with respect to minor disruptions, and potentially puts us in jeopardy. So if it really can happen with something as simple and low-tech as IV fluids, certainly the potential for something much more complex is immense.
Wow. All right, watch that. Dr. Bradley Freeman, professor of surgery at Washington University. Thanks for checking in. Have a good day. Stay warm, and we'll talk to you next Wednesday.
Have a great day.
You got it. 8:26 here, Big 550 KT.